Good morning, my name is Dr. Peter England. Today I want to talk to you about pregnancy tests. So you think you might be pregnant, what are you going to do to prove that? Well, as you would all know, the simplest way is to do a urine pregnancy test. Now these tests are quite cheap, they're very sensitive, meaning they will pick up pregnancy at a very early stage, and quite simple to do. They're best done when you're actually late for your period. Unfortunately, there's a lot of pressure, and a lot of this comes from the advertising and marketing of these pregnancy tests, that you can test well before your period is actually due. The unfortunate thing about doing that is that you will get a lot of very weakly positive tests in the days leading up to your period, but your period will still come. Now, this is not new. Research since the 1970s and 80s has shown that weekly positive pregnancy tests in late pregnancy will, in close to 50% of the time, be followed by your period. And we often use the term a biochemical pregnancy for this. We don't really regard this as a miscarriage. It's a normally occurring event. So you might be tempted to test regularly before your period's even due, and a lot of people do, but it can lead to a little bit of worry and heartache unnecessarily. So my advice would be to do it when your period is late. The tests are quite simple. You just pass a bit of urine into a cup or a jar, open up the test kit and follow the instructions. A negative test will look something like that, a single line there. A positive test will have two lines. The C is the control and the T is the positive line for a test kit. Sometimes that T line is very faint and you might want to check it again in a day or two. You'll also know that blood tests are available to test for pregnancy. So usually once a woman has confirmed a urine pregnancy test, she will quite sensibly book in to see her general practitioner or her obstetrician, or both. And as part of that first assessment, blood can be taken for a variety of things, including a measurement of the pregnancy hormone level. And this pregnancy hormone is called HCG, or human chorionic gonadotrophin, and that's what's tested in a urine sample. The urine test will test as low as 20 units, which is a tiny amount, but it's just a plus or minus result. The blood test gives us a number, and that can be helpful for tracking pregnancy in the early stages. This is particularly useful when you are less than 6 weeks pregnant and you might get a little bit of spotting, a tiny amount of bleeding, and we want to try and work out, is everything okay? A helpful way is doing 2 blood tests for the HCG hormone 2 days apart. What should happen is that that hormone should rise roughly at a rate of doubling every 48 hours, give or take. So that's an easy way to track things early on. From 6 weeks onwards, ultrasound becomes reliable for looking for the heartbeat and development of the fetus. Sometimes these blood tests can have unusual patterns. If the pattern is falling and there's presence of bleeding, that will generally indicate an early miscarriage. Another pattern, which is less common, but doctors need to be careful with, is if the hormone level is staying flat or only rising very slightly in early pregnancy in the presence of bleeding, then sometimes we need to exclude what's called an ectopic pregnancy, which is something I spoke about in a short video last week. But overall, the urine pregnancy test is a very simple and easy thing to do. Once again, try to resist the temptation of testing many times well before your period is due, as many times this is simply what's referred to as a biochemical pregnancy, and periods will often arrive on time. Hope you have a good week and that information was simple and helpful. We'll talk again soon, and I think next time I'll talk about bleeding in early pregnancy generally. Thank you.